Good afternoon to the Winnebago tribal membership and community. Thank you for joining us for this week's live COVID stream. We're very happy that we're able to provide information to the community and continue to impress upon keeping our tribal members and relatives all safe. This afternoon, I'd like to please acknowledge that we've had many deaths in our community lately, so we want to wrap you all in prayer and good feelings, and as you grieve your loved ones, and that we also share in that hardship every time there's a loss in our community. I'd also like to, on a positive note, welcome. We have the Nebraska Department of Health and Human Services with us today. There will be some guest presenters, so we're very pleased and thankful to have the director, Ms. Danette Smith, as well as the Chief Medical Officer, Dr. Antone. So we'll have a lot of good information this afternoon, and we're just thankful that you guys continue to tune in, social distance, and as nice weather approaches, that you continue to be mindful of mask wearing and all the things that we're doing to prevent the spread of COVID-19 in our community. So thank you all, and I wish you all good health.
Thank you, Chairwoman. Now we will turn it over to the Public Health Administrator, Mrna Vaccines. Mrna?
All right. Thank you, Emily. Thank you, Winnebago community. I also want to extend my thoughts and prayers to all of our mourners too. Spring is in the air on a good note. So we're returning to many of our activities are upon us, starting to return and give us hope and courage. We fought for over a year, and our fight's not quite over, but we're closer than we've ever been. I'm constantly encouraged to continue to see community members coming in each week. So I want to thank you all. Also encourage others that have not quite found their way to please come down to the next clinic on Wednesday. The weekly COVID-19 clinics are still continuing on Wednesdays. We have reduced some of the hours only because we're seeing a reduction in people, but we're now excited to be able to reach our 12 and older. So please sign up your children to come in next week. Reminding you all that COVID does not discriminate. It has no face. So please bring down your kids, your grandkids down to the clinic. There's still several ways to sign up. The website, calling the public health nursing office at 2258, or even calling anyone at the public health department, your CHRs, and letting us know, and we'll get that scheduled for all of you. So continue to watch the Facebook page. I know we have a lot of events coming up, so just stay tuned, and looking forward to summer. So with that, I will start this week's presentation. All right, so you can see from the dashboard that we have no new positive cases, no active cases. We've had a total of 351 positive cases since last year. We've had 5 COVID deaths, 346 that have recovered, and 0 households in quarantine. As of today, we've administered 2,254 first dosage, 2,160 second dosage, so a total of 4,360 vaccines have been administered in Winnebago. So from this one, you can see the breakdown of COVID-19 cases in Winnebago. So April 2020 to present, you can see our biggest age group is from 20 to 29 at 27%, followed by our 0 to 19-year-old age at 26%, and then roughly 15% for our 40 to 49 and 30 to 39. And then our gender breakdowns, starting from last year to present, is not quite half, but 54% of females and 46% have been males. So this breakdown shows a little bit different a picture, not much, but this is the cases from January 3rd, of course, when we started our vaccine community clinics. And so we had 58% have been female, 42% have been male. And then our age breakdowns for our positive cases, 29% have been 0 to 19 years of age. And then 20 to 29 years of age have been made up 24% of those cases. and then followed by our 40 to 49 years of age at 16%. So this graph, as you guys remember, from April 2020 to today, you can see that 190 have been linked to a positive case. So that left 160 that are isolated cases. And this breakdown shows all of the cases from April 2020 to present of where the exposure area for our cases were. And of course, we've had 190 of those have been close contacts, and then 89 have been from social gatherings, and then our next highest would be 47 from family gatherings. So from January 3rd to today, it's roughly about the same. So we had 20 that were positives within a household or close contacts, 19 from social gatherings, and then drastically reduced for the family gatherings of 5 and 1 from incarceration. So this just shows from April 2020 when we had our first case to today, and all of the peaks and valleys as we all have seen them over the last year, and almost a little bit of after different events that have occurred, and then we're slowly seeing that drop off since we started vaccinating. Next slide. And so this also shows the non-vaccinated versus vaccinated since January 3rd. We've had 2 that were fully vaccinated, 2 that had vaccinated with only one initial dose, and then 43 that have been not vaccinated. So this gives you an idea of the vaccination data within Winnebago. Now, remember that this is only right now Winnebago community members. And so 21% of our 19 to 29 years of age, and then followed by 17% have been from the 50 to 59 years of age, and then 16% made up from the 30 to 39 and 40 to 49. And then, of course, the female, male, as we've seen with our positives, there's more females at 57% and the males at 43%. So this demonstrates the unvaccinated persons. And so remember, this was as of last week's clinic, and so not quite yesterday's clinic. So it's starting with the 16-year-olds again. And so our unvaccinated population is really highly in the 19 to 29 years of age with 34%, and then followed by our 30 to 39 years of age at 20%, and then our 40 to 49 at 17%. And then roughly the unvaccinated person in Winnebago is roughly 49% female and 51% male. Yes, can you still hear me? Oh, thank you for watching. Oh, there she is.
Hi, I'm back. Sorry, we lost audio. Are you, Mona, were you finished?
Unless you want me to tell the percentage of the total.
Yeah.
Let me just add that in real quick.
Yeah. Yep.
Okay. So before, of course, yesterday's CDC release of the 12 and over, for our 16 and over, we're at now 70.5% of our Winnebago community members are now vaccinated at least with 1 dose. So we have started to open up our 12 and older. So if you, like I said in the initial, if you have any kids or grandchildren that are 12 and over, please contact us so that we can get them scheduled for next week's clinic. Thank you.
Great. Thank you, Mona. And we did have one question come in through our Facebook page, and I wanted to ask you, in regards to the Winnebago specific statistics. A community member wanted to know why the death number doesn't go up, because they know of more tribal members that have died due to COVID. So can you address kind of how we report the death toll due to COVID-19?
Yeah, so I do respectfully understand that there have been other tribal members that have passed on due to complications with COVID. But unfortunately, the health department only tracks those within Winnebago. And so that is the information that we're able to provide. So that's why the death number is at 5. So I would suggest, of course, the benefits office for the tribe, they are able to collect all of that information. And so I would encourage either looking at that and asking for that to be provided at some point, because they are the ones that are in charge of all of the benefits and know exactly the number of deaths due to COVID for all of our tribal members.
Great, thank you so much for that information, Mona. And just a reminder for everyone watching, especially if you're 12 years old and up, you can call the Public Health Nursing Hotline at 878-2258 to sign up for next week's COVID-19 Pfizer vaccine clinic, or you can go to www.winnebagopublichealth.com and submit the form on the website, and a representative from the Public Health Department will call you and schedule that appointment for your COVID-19 Pfizer vaccine. So, all right, moving on. We are going to turn it over now to Nebraska Department of Human Health and Services to go over some Nebraska state numbers. So, do you want to share your screen?
Yes, we do. Yes.
Okay. There you go. All right. So we'll hear from the CEO of Nebraska DHHS, Danette Smith.
Well, good afternoon, Mona and Emily and Dan. Thank you so much for having us on today. As you know, I'm joined by Dr. Gary Anthon, who's our Chief Medical Officer today, and we know that we have 15 minutes, so we're going to be brief. On behalf of the Department of Health and Human Services, we are truly sorry that you've lost one of your tribal members, and hope that the family will be well as they go through their mourning process. And so we just wanted to acknowledge that today in our conversation with you. Nebraska as a whole has been doing quite well with the testing event that we've done for almost 14 months, as well as the vaccination that we started back in December. And as you're aware, Nebraska is in what we call phase 2B, which includes persons ages 16 and on up. But as you have mentioned today in your presentation to the tribe, 12-year-olds are now able to get the Pfizer vaccine. And we do encourage as much as possible that your tribal members consider getting their children vaccinated. We always look at data as a way to inform our next steps and to inform the progress that we're making and any of the decisions that we need to make for Nebraskans as we kind of fight this COVID-19. And two of the areas that we look at are the data that you will see in the New York Times that has Nebraska ranked as of today 13th in the country for vaccinations. And then for the CDC, which is the one we really look at, we are ranked at 17th on the CDC for percentage of population being vaccinated. We have, as a state, been between 25 and I'd say 10 at the best in terms of our vaccination rate. We've been very aggressive. We are doing a lot of community engagement and educational opportunities to explain the importance of vaccination and that it provides an extra layer of covering from COVID-19. As you can see, 49,016 vaccination dosages were administered last week. And just so that your tribe knows, about 3 weeks ago, we were up to about 180,000 vaccinations that have been administered. And as you have said in your Winnebago PowerPoint, that we're beginning to see the decline of the vaccination. And here in Nebraska, just like states across the United States, we are beginning to see a plateau. Next slide. The vaccinations, as I said earlier, provide a tool to give individuals one more extra layer of covering. And as you have said, and I say this every time that I talk to people, please continue to use your mask. Please wash your hands. Please be in small gatherings, not large gatherings. Even though it appears that we're coming out of it, we want to make sure that we are coming out of this by using those non-pharmaceutical interventions that will help us keep not only you, but also your family safe. We've been on a strong campaign called Finish Strong Nebraska, and we hope that you will help us spread the word about how important the vaccination is here in Nebraska. The members of the Winnebago tribe, I know I heard the phone number being announced, but I'm going to give it again if that's okay. 402-878-2258. And again, we want to give that number out to your tribe members so that if they have questions, they want to get signed up, that they will indeed utilize this number. The website is winnebagopublichealth.com/vaccinate waiting list. Or again, I'm going to give that number again, 402-878-2258. As of this morning, we had close to 383,000 Nebraskans who have registered for the vaccination. We're very happy about that. We've had 1,624 of those being Native Americans for a 0.42%. In terms of African Americans, I always give numbers about communities of color because people ask me about that. For African Americans who are getting vaccinated, it's at a 2.74%, and Hispanic 6.9%. The average age of persons who are getting vaccinated is 51 years of age. In Nebraska, as of this morning, 753,000 Nebraskans, yay, have been fully vaccinated. That looks at about 50.8% of the population is fully vaccinated, with approximately 3,000 of those persons being Native American, which is a 0.4%. We have 1,008,000 dosages have been allocated to the state of Nebraska. 1.5 total dosages have been administered. This not only includes the vaccines that we get, but also what we get from our federal partners. So we're measuring it, what comes down to the federal partners, which is our local pharmacy stores, and then what we are doing on the side with the FQHCs, health departments, local public health departments, and health centers. That accounts for that 1.5. So 85.2% of the allocations we have received have been administered. So what we've been trying to do here at DHHS is, as I said earlier, we've been very visible. We've done a lot of town hall meetings, more than I can count at this point. Would you agree, Jeff and Dr. Anthon? I've done so many town halls that make your head swim. But we want to educate Nebraskans about the vaccination, make sure that they have good information so that they can make a good decision about their health. Again, we're trying to vaccinate so that we can return back to, as much as possible, some type of normalcy. And we're also pushing out our campaign, finishstrongnebraska.gov. Again, that COVID information line, and this is the one that is for the state, but I'm going to give that as well, is 833-998-2275. Again, that number is 833-998-2275. And as always, we are always happy to answer questions, do town hall meetings, provide good information so that Nebraskans and Native Americans can make really good decisions about their health. So with that, I'm going to turn it over to Dr. Anthon, who's going to go a little bit more into detail about COVID-19 and what we're experiencing here in Nebraska. Dr. Anthon?
Thank you, Danette. And Thank you, Mrna, for that presentation. Those are very good slides that you showed, and really good information for us down here. So thanks for doing that. As Danette said, I'm going to talk a little bit, if I can have the next slide, about how we're doing in the state of Nebraska. Just like Mrna presented, we keep track of the number of patients that are hospitalized on a daily basis in the state. And we learned early on in the pandemic that hospitalizations were one of the few metrics that we can rely upon to know what's going on in the state, because either a patient is ill enough to go to the hospital or they're not. So that is a data point that we can rely on. As you can see, we did very well up until around early October of this year as far as how our hospitalization data went. And then around early October and into November, up till Thanksgiving time, we hit our surge. This was a definite surge, and this was obviously before the vaccines came out, and we reached about a total of 1,000 patients in the hospital statewide with COVID diagnosis. And that is represented on the solid line. Right around Thanksgiving time of last year, we started to see a decline in those number of hospitalizations. And it couldn't have been a better timing for the vaccines to come out in early December. And we continued to see a decline in hospitalizations all the way from around Thanksgiving time till the beginning of April. And you can see in the beginning of April how we started to see an increase again in our hospitalizations. And then now how it sort of plateaued out, if not slightly decreasing again. And that is almost entirely due to people getting vaccinated. So just like you showed in that slide, Mrna, it was a great slide of the number of people that were in the hospital that were vaccinated and not vaccinated. That can't be any stronger point for people to go ahead and get vaccinated. So if we could go to the next slide, you can see we also keep track of how many people have gotten tested in the orange line. We've been right around 54% here today of the number of Nebraskans that have gotten tested. The yellow line represents the number of people that have tested positive, right around 11.5%. And the purple line represents our test positivity rate, which over the last several weeks to months has been right around 4 to 5%. And if we go to the next slide, I'm just going to go a little bit into the vaccines that we have available into Nebraska now, and then talk a little bit about the variants that we're experiencing here in the state of Nebraska. So we have 3 vaccines that are currently available in the United States. The first 2 to come out were Pfizer and Moderna, and they're called mRNA vaccines. And they're based off the spike protein of the virus, which is what is allows the virus to attach to our own cells to then infect us. So the scientists were able to sequence the genetic code for that spike protein in an mRNA sequence, envelope it in a lipid coating, put it into a vaccine, inject it into your deltoid muscle of your arm, where now that mRNA makes that spike protein, and that spike protein is what causes our antibodies to be developed. So that if you become infected with the virus, those antibodies remember what that spike protein looks like and then neutralizes or kills that virus. So very, very high science, but this is what enabled us to go ahead and keep us from getting our surge again, which I showed we were going to probably have in early April if we didn't have these vaccines. The other vaccine we have, next slide, is the Johnson & Johnson vaccine, which is very similar, except rather than using mRNA, it uses DNA. The DNA goes into an adenoviral vector, which then causes the spike protein to be made and then develop those antibodies, just like I showed for the mRNA. The difference is that the vector, the carrier for the DNA, is in an adenovirus that is now called viral incompetent. It cannot replicate. But the DNA that's inserted into that adenovirus can make that spike protein develop those antibodies. And why do I even mention this? If we can go to the next slide, The reason is because we're starting to experiencing these variants, these mutants that are taking place with the virus now. We were doing extremely well when we had just the one type of strain, but now we know we have multiple variants of concern, VOCs we call them. And that's why we're still very cautious. And that's why, as Danette says, we still need to be using our non-pharmaceutical interventions until we get our vaccination percentage in the population up to where we think we can keep those variants under control. And if we go to the next slide, basically what happens with these variants, that mutations take place on the spike protein of the virus. And it's a spike protein, again, that allows that virus to attach to our cells and then infect our cells. And the next slide will show if it's a good fit, if that spike protein fits to the cell receptors well, it's going to be more transmissible and more lethal, most likely. And so we want to prevent that from happening. And what it does is we know these mutants, these variants, can cause a higher transmission rate and maybe a higher hospitalization or lethality rate. So we want to keep that under control. Go to the next slide, Jeff. So right now we have these types of variants here in the state of Nebraska. We have the United Kingdom, the UK variant. We have 764 identified now. We have the Brazilian variant, we're up to 12. South Africa, 6. California, 87. And New York, 6. And we're able to know these variants by when you get a test. The test now, we sequence those positive specimens and know whether it's a variant or not. And the next slide will show what percentage we are getting for these variants. So we've totaled now 875 variants identified in the state of Nebraska. Currently, of all the positive tests that we're sequencing now, 90% are due to the variants. The most common being the UK or the B117 variant. 85% are that, and we want to keep that under control. Specifically, we want to keep those other variants under control, the Brazilian and the South African, and maybe now the new variant that might be coming to the United States is from India. So we want to keep those variants under control. Luckily, or gratefully, or maybe through divine intervention, so far all 3 vaccines have been effective against these variants. So again, we need to keep those under control by getting vaccinated. And then the last slide, I think it is, maybe that's the last slide there, but the reason for getting vaccinated now is that if we can reach that certain percentage of immunity in the community, we can keep those variants from multiplying to make it so we might not have the vaccines be effective anymore. So now's the time to get out there and get vaccinated, and I'll end it there. Thank you very much, Emily. I'll turn it over to CEO Smith. She might have some closing comments here.
No, you
No.
got it.
Okay.
Emily, anything else for us?
Yeah, I was wondering if you could answer a few questions, Dr. Anton. 2 questions we kind of hear a lot in the public health department, and we have a lot of our community members ask us about is, one, herd immunity and what that means. We explained it, but especially with the COVID variant, can you go into what herd immunity means and why we want to get there?
As Danette mentioned, right now in the state of Nebraska, and you guys are doing great in your community, we want to try to we're about right at 60% of the population of Nebraska getting at least 1 dose of the vaccine, which means in 3 or 4 weeks, we'll have 60% of the population of Nebraska vaccinated. Most numbers you hear are in the 70 to 80% range. We want to get up there. We're getting there. We're definitely getting there. We used initially our way to get people vaccinated was have people come to places to get vaccinated. Our next focus will be to go to them to get vaccinated, or have them go to their providers or their local pharmacies to get vaccinated. So we've sort of slowed down, as Danette mentioned, our number of people getting vaccinated, but we've got to make it so it's more accessible to them, and that'll be the next step. If we can get between 70 and 80% of the community vaccinated, that's where most people think that herd immunity is at.
Great, thank you. And then lastly, a question we also get, as you saw in Mrna's statistics, the largest portion of our unvaccinated population in Winnebago is actually our youth. And hopefully we can increase those vaccination efforts. But what we hear at our clinics when we see the youth come in for vaccines, we've been asking them, why don't your friends or people you know, why aren't they interested in getting vaccinated? A lot of them talk about it's because there's this fear that they won't be able to have kids, or you also hear, well, I'm pregnant and I can't get the vaccine because I'm pregnant. So what would you tell a patient or our community that has those concerns or is pregnant? Can they still get the vaccine, and what would you recommend for them?
So there's two parts of that question, Emily. The first is the fertility question, and that has been absolutely proven not to be the case. So these vaccines, I showed how they work. They work by using this strand of mRNA or DNA, which really has nothing to do with fertility. So I would not say that's an issue at all. As far as, we had a little bit of a talk about this morning on pregnancy, and the best thing to do is to get vaccinated before you're pregnant. But even if you are pregnant, the vaccines have still proven to be very safe and effective. As a matter of fact, I have a daughter who got vaccinated during her pregnancy. So as far as the data goes, no issue whatsoever. What you want to do is try to prevent from getting infected during the time of your pregnancy where you're about ready to deliver. So a lot of people say, if you are pregnant, go ahead and get that vaccine, hopefully so you can have that immunity before you go into labor.
That's great. Thank you so much for that information, and we appreciate that insight. So Jeanette, Dr. Anthon, thank you so much for joining us. Do you have anything else to add?
No, we appreciate you considering us and allowing us to talk to your tribal community, and we look forward to partnering with you in the future.
Great, thank you. So now we will head over to Dan Farringer, the Superintendent of Winnebago Public Schools, for an update. So Dan?
Good afternoon, everyone. First of all, condolences to the families who are in mourning. The vaccination clinic is being held in the practice gym on Wednesdays and is going well. WPS will continue to host the clinic until the vaccination needs of the community are met. Spring activities are underway. Football at Macy tonight. Information on Alert Now and WPS Facebook. District track was at Ponca today. We had prom on April 17th and it went well. The spring musical, Singing in the Rain, was a hit. Congratulations to the cast and crew. The graduation for the class of 2021 is this Sunday, May 16th at 2 p.m. in the gym. There are 41 graduates. Each graduate was given 15 tickets to give to family members. A ticket is required to enter. We will follow health safety measures. We will have masks required. We'll have sanitizers, and we'll social distance as much as possible. The graduation ceremony will be live streamed by G&L Productions, and Garen will take pictures of the seniors. Summer school letters and information will be sent out next week. Again, protocols being followed, and no staff members are in the building if he or she tests positive until the notice says he or she can return. We continue to keep the building and classrooms disinfected, wear masks, use desk shields, hand sanitizer, and social distance when possible. Again, it's imperative that we continue these safety measures as we go into the summer. Thank you.
Great, thank you, Dan. And lastly, as we sign off, I just want to remind everybody that they can sign up for the vaccination clinic in case you didn't hear it enough already by calling 402-878-2258 or going to the website at www.winnebagopublichealth.com/vaccine waiting list. Also, we are giving away $15 Hy-Vee gift cards to Winnebago community members who come and get their vaccine. So if you have already gotten your vaccine and have your vaccination card, you can come to the clinic on Wednesday from 9 to 11:30 and just show us your CDC vaccination card as proof of your vaccine, and we will hand you right then and there your $15 Hy-Vee gift card, and that can be used for gas, anywhere in the grocery store, for food, you name it. So come get your gift card and get vaccinated. You can pick your gift card up as well if you're getting your first dose, but there is a limit for one gift card per person. So if you've already gotten your gift card for your first dose, you cannot get a second one for your second dose. But now that it's 12 and up too, the gift card applies for anybody 12 and up who has gotten their vaccine, but you have to be living in Winnebago. So limit one, first come, first serve on Wednesday at the clinic at the Winnebago Public School practice gym. So that wraps up today's community update. If you have questions regarding COVID or the vaccine, you can email covid@winnebagotribe.com or comment on the Facebook page, and we will do our best to answer those in the next COVID community update next month, which is now scheduled for June 10th. That's Thursday, and we will see you all then. Thank you for watching, and everybody be safe and be well. Thank you. Okay, cool. Are we out? Thanks. Sorry, we've been having really bad internet issues over at the hospital, and I think I don't know. I went home to try. Yeah, I don't know, but okay. So great. And are you able to do that COVID video this week then still? Do you think you could still post it? Okay. Maybe we can post that like between today or tomorrow, since there's not going to be a COVID update for next week. But I did post the flyer on the Facebook page if you can share that for the 12 and up. Yeah. And then Garen, just as an FYI, I have some flyers that are actually